2 summers ago, it was around midnight, and I was an emergency room volunteer. Not as dramatic as it sounds, I was basically greeting people and taking them back to the patients. But I had an experience that stuck with me for the past 2 years. One night, a guy came out, and he had just been discharged, and he was very disoriented from all of his medication. And he didn't have a way to get home. He went over to the nurse's station, and he asked if there was anything they could do, like a bus pass or a cab voucher, so that he could get his transportation home. And the nurses were pretty confused, and they said, "I'm sorry, we can't really do anything for you. We couldn't afford that cost to support everyone who needs it." And so the guy didn't really know what to do. He wandered over to my side of the waiting room, and he said, "Can you help me out?" And I said, "Where do you live?" And he described an area about 8 miles away, and it was kind of near where I lived, like maybe the next neighborhood over. And in order to get there, he would have had to cross avenues and major roads at night. And it was drizzling a little bit, it was dark. He had just been discharged, so he was sort of medicated and a little disoriented. And I said, "This doesn't look right. I can't let him just go walk home." And so I said, "I'm getting off of my shift in 5 or 10 minutes. Why don't I give you a ride home then?" And so that's what happened, and everything worked out fine. But over the next days, weeks, months, I began to wonder why this happened. How in a healthcare system where we pay so much attention to what happens to a patient in the hospital while they're staying or in the clinic while they're seeing their doctor, how could we forget about patients on that last mile home? Or for that matter, the miles they need to traverse to get to the clinic or hospital in the first place. So this led me to research more into the problem and talk to people about why this happens and what we could do to stop it. And so this was the actual emergency room that I was working in that day. And in a later conversation I had with an endocrinologist in Wisconsin, she said, "You can provide the best care in the world, but it doesn't matter if the patient has no way to get to it." So that really resonated with me. And over last summer, I started researching an article that eventually appeared in The Atlantic, and really gave me a chance to learn about this issue, research it in depth, and then write about it and publish. So that was a great experience. And over the course of that process, I learned that 3 to 3.5 million adults struggle with transportation to healthcare at any given time. That's a pretty big number. I think it's more than a lot of you would expect, because transportation is thought of as, it's almost taken for granted. Everyone either has a car or lives near a public transportation line. But that's just not true. There's lots of people who live on the fringes of cities or in places with dilapidated public transport infrastructure, or they don't own a car, or if their family does own a car, it's shared among 3 or 4 people. So there are lots of reasons why people struggle with access to transportation. They could be elderly, they could be disabled, low income, low resource. And so that adds up to about 3 to 3.5 million adults. And this creates a big problem, because for providers, they have a high no-show rate if they have lots of patients who struggle with transportation access. And 25% of these no-shows are attributable to transportation-related barriers. Now, we do have some programs to help people with transportation. One of these is non-emergent medical transportation, which is provided to a lot of Medicaid patients. Basically, they take fleets of vans, and if you call within 3 days before the ride, you can get a van to come pick you up. The problem is the vans are chronically late. They don't pick the patient up in the first place. They leave them at the appointment. They clock out at 5 p.m., so if you have an appointment late in the day, forget about your ride home. It's really horrible. There's headlines you can look up. It's just the status quo has got to change. And so now I'm working on a venture called Ride Health. And I've entered the President's Innovation Prize for this, and currently in the semifinals. I'll find out next month whether we get the award. Basically, this would enable clinical practices to coordinate rides on behalf of their patients by tapping into ride-sharing services like Lyft, Uber, Sidecar, or if in a certain geographic area, the taxi company might be the best. Maybe they don't have Uber and Lyft yet. But whatever the best way of transportation is in that area, this platform will let providers tap into that. And they will be able to see live GPS tracking. They'll be able to calculate when they need to call the ride based on live traffic. They can do automated outreach to patients using predictive analytics about which patients have been no-shows in the past. And at the end of the day, it's all paid for by insurance. So it's at no cost to the provider and no cost to the patient. And the patient doesn't have to have a phone. It's all done by the provider. So I guess stay tuned about whether this becomes a thing. If it is, you'll hear about it. If not, I guess you won't hear about it. But I'm really passionate about this issue. So I appreciate the time you've taken to learn about it today. And I'll be happy to take any questions. I guess we're doing questions at the end.
Yeah.
All right. Thank you all.